Pronto.
Hello, everyone. Good afternoon, and welcome to another Coffee and Science. This is the seminar from the Brazilian Studies Program and the Brazilian Society at the University of Oxford. My name is Andresa de Souza Santos. I'm the director of the Brazilian Studies Program and a lecturer at the Latin American Center. And I have the honor to host this seminar series with my colleague Darlan Cândido, who has graduated as a pharmacist from the Federal University of Ceará, and he holds a master's in allergy and immunopathology from the University of São Paulo. He's currently a PhD candidate in zoology, also here at the University of Oxford, and he applies genome sequencing to understand virus evolution. And he's currently working on the SARS-CoV-2 outbreak in Brazil. Darlan is currently the president of the Brazilian Society. Sorry, I see that my camera is cutting half of my face, so adjusted. So he's currently the president of the... Sorry, is it better?
Yes, that's better.
Okay. He's the president of the Brazilian Society. He's chairing this seminar series with me, and he's going to introduce our guest for today's talk.
Hi, good afternoon, everyone. Thank you very much for being here. This is the first Coffee and Science of Hillary term, so it's really nice to have everyone watching, and we would like very much to say thank you to Fernanda for accepting our invitation, being here today to speak to us. So Fernanda is a doctoral researcher at the Center for Socio-Legal Studies at the University of Oxford, and she holds a master's in law from the University of São Paulo. Before coming to Oxford, Fernanda was a law clerk at the Superior Court of Justice in Brazil and an assistant at the Public Prosecutor's Office in São Paulo. Currently, she serves as voluntary director of policy and governance at the IYF. So thank you very much, Fernanda. The floor is yours. Just one question. What is IYF?
International Youth Federation.
Oh, okay.
It's an NGO for youth empowerment.
Okay. Oh, that's really cool. Yeah. Okay. So thank you, Fernanda, and the floor is yours.
Thank you. So thank you, first of all. Thank you very much, Andresa and Darlan and the Brazilian Studies Program for the invitation. The Coffee and Science is such an amazing initiative that you guys have, and it's really an honor to be presenting here. So I'm going to talk to you today a little bit about healthcare litigation, right? So accessing healthcare via courts in Brazil. So this is the result of my PhD research, which I conducted at the Center for Socio-Legal Studies at Oxford. And for the past 5 years, I've been analyzing this incredible phenomena, which takes place not only in Brazil, but it's observed throughout Latin America, in Colombia and Argentina. There are some comparisons in India, in South Africa, and to some extent in the UK as well. And yeah, so I'm going to present you a little bit about my research today. So what is healthcare litigation, right? So what I'm going to talk to you about today is not the litigation for damages. So when we talk about litigation, usually lawyers think about people that sue doctors or medical doctors or hospitals for damages, right? I mean, there was a problem in their surgery, something went wrong, and they ask for compensation. So this is not what we're talking about, right? What we're talking about here is people that go to courts, right? They sue the state or private insurance companies to get access to medical treatments, to drugs, or to devices that are either not covered by the healthcare system of the country or the insurance, or that are covered, but for some reason those people couldn't get access to that, right? So against whom can these claims be put forward? So they can be against the state. Particularly in Brazil, we have the responsibility of promoting healthcare is divided, is solidarity between the federal, the regional, and the municipal levels, which means that you can sue either one of them. right? You can also sue the private insurance companies to get access to drugs and treatments that you need, or for medical treatments that you require. My focus is on lawsuits against the state, right? So against the public power. So what is the model, the nature of those claims, right? So healthcare litigation can happen, and this depends, is a bit different from country to country. In Brazil, as is in Colombia and Argentina, for example, it can be either individual or collective. What that means to say is that people can go, Fernanda, for example, can go individually and start a litigation against the state of São Paulo because I need a drug for a specific disease that I have and that is not covered by our universal healthcare system, the SUS, right? Or it can happen collectively. So let's say that a group of patients that have a particular disease that can be or not represented by an association, let's say, they can also sue the government, either the city of São Paulo, the state of São Paulo, or the federal government to access that drug. What it would be different here in the collective case is that you would have a discussion that is a bit broader, that is about including that drug in the system, right? What happens is that most of the claims take place individually, right? So the overwhelming majority of litigation against the public sector and against insurance companies in Brazil, as in Colombia, are done so individually. And there's a reason for that, which we're going to see in a second. So what we have today is what we call a mass litigation, right? We have insane numbers of claims that are filed every day in the Brazilian courts, as happens in Colombia, and that are analyzed urgently because they usually involve a question of healthcare. So the person is either very sick or they need an urgent treatment. So it's considered an urgent matter. So the judge needs to analyze very quickly, right? And these cases are flooding our system. So there is a problem of quantity, and here there is a graph which was not produced by me. This was produced by INSPER in Brazil, and it's part of a very, very interesting research they did, mainly quantitative research they did, and was published in 2019 about healthcare litigation in Brazil. So here you can see only the cases that are in the first degree, filed in the first degree, in the thousands, right? And you can see a sharp increase between 2009, 2017. This continued to increase up until this day. So it's a variation of plus 198% in the cases, okay? So there's a problem of quantity, and there's a problem, which is probably the worst problem, is the impact of those claims. So from 2007 to 2018, the spending of the federal government with drugs that are granted via litigation, so granted through the decision of a judge, grew 4,600%. So in 2016, the Ministry of Health in Brazil had spent 1 billion reais with 1,200 patients. So the impact in the public budget of those claims is incredible. What is being done about, right? So it is a problem, and however, is a problem that is being tackled through patchy solutions. So we have a lot of different initiatives being done in the different states of Brazil. We have, for example, the National Council of Justice, NJ, which has yearly forums about healthcare, where you have people discussing, lawyers and people from the administration discussing healthcare litigation. And the only thing that we see is these numbers increasing, and the whole left by the budget that is taken increasing, right? So why does this happen? Why does this take place? And then there's kind of a two-folded analysis, and this is why it's a socio-legal analysis, because it's both a legal, but it's fundamentally a sociological analysis. So the legal factors are mainly the incentives, right? So it's really, really easy to litigate in Brazil. it's really, really easy to put forth anything, right? So Brazilians, you ask Brazilians, and most people have gone to the judiciary, to the small claims courts to solve an issue, right? They have a problem with anything, with your bank, with an airline company. Everybody goes to court. It's easy, and you know that you're not going to spend a lot of time. You're not going to spend money. Usually, filing these claims costs zero, nothing. We have a good public defender's office in Brazil, which means that people that do not have access to lawyers have access to a free service, which is very good quality by the state, right? And the success rates are really, really high. So most cases are granted. So most cases people win. They get access to whatever it is that they are asking for, right? So the incentives are wonderful. The incentive is, if you need a drug, you can't get it in your public hospital. If there is a problem, it is included in the system. It is part of the SUS, but for some reason doesn't have in your hospital, go to court. It's going to be quicker than seeking any other measure. If it's not included in the system, then even better. Go, because that's the only way you're going to get it, right? Part of this problem is legal and it's part of a larger problem of litigation of socioeconomic rights. So, for example, education, sanitation, which is the constitutionalization of rights. I'm not going to spend a lot of time here. We're going to see something interesting towards the end. But health is a fundamental right in Brazil, right? So it's in the Article 6 of our Constitution, and in the Article 196. Our Constitution says that health is a right to all and a duty of the national government and should be guaranteed, right? So which is read as healthcare is universal in Brazil. Everyone has to have access to healthcare. In Colombia, for example, and this is interesting, health is not a fundamental right, is not under the title of fundamental rights in Colombia, but ever since the 90s, when the new constitution, 91, when the new constitution was established, there was a jurisprudential construct by the Supreme Court that understood that because healthcare derives from right to life and right of the dignity of the person, which are fundamental rights, then healthcare should be understood as a fundamental right, right? So the tutelas, which are the instruments, the legal instruments in Colombia that are very similar to what happened in Brazil, can use this jurisprudential construct, right? So again, we talked about the individual cases. Another important point about legal factors is that any judge can analyze these cases, right? It's different from other countries where, because it is a constitutional matter, only the Constitutional Court or the Supreme Court would be able to analyze. In Brazil, any judge has the power to analyze a constitutional claim and has the power to therefore analyze litigation to access to healthcare, which means that judges across Brazil, in every single city, in every single town, are every day analyzing claims, asking for drugs and treatments, and are granting those claims, right? So you have kind of this atomization of healthcare throughout Brazil, throughout the country. More interesting for me, there's a lot of study about healthcare litigation because it's such a big problem. There's a lot of data. So there's a lot of quantitative studies as well. Winsper has done an amazing job analyzing this data, in the quantitative analysis. My analysis is qualitative. So I went to Brazil in 2017 and I interviewed 50 people from all spectrums. So between judges, litigants, representatives of the healthcare, of the executive, right? So people that are involved in the construction of the public policy of healthcare in CONITEC, which is similar to NICE in the UK. So it's the part of the Ministry of Healthcare that determines which drugs are going to be included in the system. Anvisa, public defenders, prosecutors, lawyers, representatives of patients' associations, representatives of pharmaceutical companies, medical doctors. I interviewed throughout, but I focused on judges and litigants, right? And then from judges, from the first degree to the Supreme Court. It was a semi-structured interview-based study, everything anonymized, which means that there is no, I would record, but then after I transcribed, I would anonymize everything. There is no indications of names in the thesis. And people, when they were interviewed, they knew that, which meant that, of course, they were more comfortable to speak freely, right? And I would start normally, a little bit different for the litigants, but I would start normally asking, why do you think healthcare in Brazil reached such levels, right? And the first answer, and here I'm going to mostly talk about judges. The first answer was because we cannot trust our executive. We cannot trust the Ministry of Healthcare to do a good job. We cannot trust that when they say that they don't have enough budget, they don't have enough money to include X or Y drugs, we can't trust them. Look at the amount of corruption that we have in our country. Look at how inefficient our institutions are. Why wouldn't I grant someone a drug, right, a treatment, when I see this happen? So distrust was a big part, was like a cornerstone of the sociological factors. Then there are other sociological factors which are interesting. For example, judges show a lot of empathy towards the parties. Most often than not, they wouldn't see the party. So it's not that the person come to them, they see them in the face, and then they hear what they're going through. No, they're mostly just analyzing the documents, right? But nonetheless, these judges, and we have to imagine the individual judge who is in a city of let's say, Rio de Janeiro, seeing the poverty close to their eyes, seeing the people suffer, they feel, and knowing that they have a very big power to impact those people's lives, these judges add the empathy to the suffering of those people, the power that they have and their perception of power, which I call empowerment, right? Judicial empowerment, what we call the power of the cloak, right? In Portuguese is poder da caneta, that a lot of them use that phrase. So they put these things together and say, this is where I can do my part. This is where I can change someone's lives. So some of them actually went all the way to paying the treatment when even by giving a decision, granting a judicial decision, the public authority wouldn't comply because it just didn't have money. I heard one judge saying that she paid from her own pocket. So this is kind of the level of involvement, right? Interestingly, and I thought there was quite a plausible explanation, right? One of the factors within all of this was a Supreme Court justice who told me, look, there is a level of distrust in politics that people don't want to be involved in politics. So you have this generation, very long-lasting time, generations of lawyers who would get out of university. They wanted to do something, right? They were idealists, but they didn't want to go to politics because they didn't want to be in the middle of the corruption. They didn't want to be exposed seen as politicians, and they went to the legal careers, either being prosecutors or judges. So you have these generations of judges and prosecutors who are eager, and the public defender who are eager to do something. They want to change something. They're also part of the context of Brazil, which is a context of inequality, of historical exploration, concentration of power. Brazilians know that, right? As do Colombians. We all know the problems of our country. And in some way, that's how they find to solve it, to help their community, right? On the litigant side, and this I think is a very interesting contrast, I would start a bit different. They would tell me their story. They would tell me what they're going through, why they needed the drug, how they found out. So it's very interesting that usually most litigants would tell me they found out they could go to courts through their doctor. So their doctor would say, just find a lawyer, or here is a lawyer. Through the pharmaceutical company who produces the drug they're using. So in the cases of drugs that are very expensive for diseases that are called rare diseases, right? Or very complex diseases that need very expensive drugs. There were cases that the litigant was given the name of a lawyer or was already taken care by the pharmaceutical company. They would pay the legal expenses, right? And so they would start telling me their story, how they found out about it. And then I would ask them, okay, so by the end I would ask, okay, so do you trust the judiciary or the judge, right? Some of them would take very long time to understand what I was asking. And then they would say, yeah, I guess I do. And then I would come back. So what do you mean when you say you trust the judiciary, you trust the judge? We would expect that they would say, well, they are the last bastion of democracy, right? They are last hope, something like that. But no, the answer would be, because I can get a drug. So it's like a counter, right? People go to the judiciary because that's where they get the drug. It is trust, but it's the trust in the outcome of the litigation. Is a utilitarian trust. And it's there that we observe the individualism of our society, right? This relationship that we have with public services as a commodity. How do we relate to something that is of everyone, right? Healthcare is not an individual right. Healthcare is a social right, is a right of the society as a whole. And obviously, budget is not infinite, which means that, unfortunately, not everyone can have anything, right? You need a policy which is designed to filter what is best for, in the limited budget that we have, what is best for the society, the community, right? And then there is another component which I already kind of touched upon by telling the stories of the litigants, which is the powerful economic interest behind all of this. I'm not saying that this is the reason why healthcare litigation takes place in the first place, but it is an important driver, which is the economic power of the pharmaceutical companies, right? And this might be the reason why we don't see the same phenomena happening in education, for example, or in sanitation. There is a strong interest here for especially very expensive drugs to be included in the system. The bureaucratic process through which these pharmaceutical companies have to go through to include their drugs in the system is lengthy. Several times it is stalled. There are problems at Anvisa when they're analyzing. The processes can be quite lengthy. After that, they have to go through the process in Conitec, where there's analyzed the cost and the efficiency of those drugs. So to discuss if the price of that drug and the number of people that it's going to serve, if that justifies. So it is a deterrent, right? It is a lengthy process, and it makes sense that is lengthy, right? So some companies, I'm not saying all, but some companies have found through healthcare litigation a way of having the public sector buy their drugs through a back door. But they don't sue the governments, right? They're not parties in those litigations. They are in the back seats. And how that happens is very often they would donate money to associations of patients who will then offer free legal advice, amongst other services that these NGOs provide. Some of them would provide free legal advice and free legal services to people that have that disease. So, which means that sometimes you would have people going across country, calling doctors, asking, do you have someone with that disease? If you do, send them to our NGO, and we're going to cover all of their legal expenses, and they're going to have a decision, first an injunction that is going to give immediately the access to the drug they need. Then they're going to have access to this drug, and they're not going to spend a cent. So they actually get to the patients what they need, but at the same time, there's a distortion in the way that the public policy is being done and that healthcare is being fulfilled, right? So you do have a significant portion of the pharmaceutical industry who is against healthcare litigation, who see how this distorts the system, and who is fighting for a more rational way of dealing with healthcare policy. Decisions versus interviews, and this is where the two components, the legal and the sociological, kind of interact, right? And here is mainly a criticism, I guess, to lawyers, to the formal legal discourse, to the processes that we use. So, and kind of a moment of reflection of what are all of these for, right? So what I did was I analyzed 700 decisions of the judges that I interviewed. So I searched for decisions from those judges, and I compared to the 19 interviews, okay? And then what I did was I used keywords in Python. I used keywords and I searched for the occurrences of those keywords, both in the interview and in the legal decisions. And what we see is an absolute disparity. So, for example, if you look at trust or corruption or inefficiency, which were the central topics of the interviews with judges, they appear 0 times in the decisions, right? The decisions are all done revolving, right? Their reasoning is all in constitutional discourse, right? In constitutional reasoning. And this is a problem because although Constitution is the one that grants us the right in the first place, this reasoning is hiding an essential problem, an institutional problem, a problem of a crisis of trust, interinstitutional crisis of trust, of the judiciary taking the place of the executive. This is not a normative statement I'm making here. I'm not saying if it's bad or if it's good. Of course, there's a problem of budget rationality. But what I'm saying is this is happening. And it's not happening just because we have the right to healthcare in the Constitution. This would be the conclusion you would probably reach if you only read the decisions, if you didn't examine in depth the underlying sociological reasons. But that happens because our institutions are fragile, because our judiciary is taking the place of the policymaker, right? So what is the conclusion? It's a complex phenomenon. It cannot only be analyzed from the legal side, and it won't be understood out of context, right? So the legal factors are essential, but we need an in-depth exploration. We need to understand what lies behind all of that, right? The conclusion is that there's a crisis of trust that invaded the interinstitutional realm. So the different institutions are not speaking to each other. We have something that I call institutional islands, right? So you have different institutions that are doing their own thing. And I'm not even talking about the 3 powers. I'm even talking within the institutions. One person that I interviewed from Anvisa, I asked them about Conitec, and he didn't know what Conitec was. Conitec is part of the Ministry of Healthcare, and after the analysis of Anvisa is the one who analyzes if that drug is going to be included in the system. It is a fairly new body, but nonetheless, this person who worked with medication analysis at Anvisa didn't know who they were. So there is a problem of the bodies of our government not speaking to each other, right? The bodies of the state not speaking to each other. So judges most of them didn't understand. They don't have an in-depth knowledge of how the healthcare system works, of how the policy how the policy making works. This is also part criticism to how legal education is done, because we do not learn public administration, we do not learn healthcare. Also, judges have to decide from crimes to healthcare to tax to, right? First degree judges, especially in small towns, have to decide everything. So, of course, you're not going to expect them to be experts in healthcare policy, let alone in the diseases that they are having to analyze, right? So there is a necessity of a connection. There is a necessity to build bridges between the institutions and to rebuild trust amongst the public authorities, right? If our public authorities don't trust each other, we're not going to expect that the citizens will trust them, right? So one of the ways of doing that is putting people together. So the judges that I talked to, who minority, but the judges who were part of some sort of discussion group with doctors, with people from the public policy, they would tend to have a bit more difference. And this is something that we can compare in a way with the UK, where you have healthcare litigation. You do have some cases of people, and especially associations or representatives of litigants, who go to court to ask for a drug to be included in the system. And this is a bit different because they're not asking for the access to the drug itself, but they're asking for the inclusion in the system. You would have the court being way more different to the public institution, right? To the NHS, which is the healthcare system in the UK, and NICE, which is the equivalent to the CONITEC in Brazil. That makes the decisions of cost efficiency, right? So you would see in the language of the decisions, I have not interviewed judges in the UK, but you would see in the language of the decision, things like, we know that how hard it can be for someone not to have access to that drug, but the decision was taken by a technical body of experts who analyze that in depth. Is not the role of the courts to do that. Again, I know how problematic the situation in Brazil is. It's not easy to compare a country that has the resources such as the UK with such an equal poor country like Brazil. I wouldn't want to be in the shoes of the judges who have to analyze that. I would probably grant them myself, to be honest. But I'm just showing you guys how many layers there are to healthcare litigation. It is important to think about those things now. We are amidst the pandemic, and we are already seeing a lot our judiciary intervening in the public, in the decisions that are taking in the policy making regarding COVID, right? I'm not discussing here if they're necessary or not. They probably are. Now more than ever, we have a government that people don't trust, right? And you have now more than ever the judiciary, especially now the Supreme Court, being extremely influential, being extremely present in the policy making. And if we are going to accept that, yes, the judiciary has an important role in the policy making, that we need to start including them as political actors and not just technical lawyers. They are also political actors, and we need to acknowledge them as such. And not only the Supreme Court, but the thousands and thousands of judges that are everywhere in the cities across the country. So this is what I wanted to present you with. I'm open to questions. And yeah, thank you.
Thank you very much, Fernanda. This was an amazing presentation, extremely timely, of course, when we think about, as you said, what is happening to COVID-19 in Brazil. We saw the decision of the Supreme Court, I think it was on the 15th of April, that the president could aggravate the coronavirus crisis, and therefore really taking the decision that municipalities and states, they could be sovereign in managing the pandemic. Mm-hmm. And the issue of trust becomes really in the core of the discussion. However, I was very impressed on your presentation that trust is also a discourse, but not always the fact that is leading, if I understood correctly, all the problems that judges talk a lot about trust, but in the sentence, they not always have it
they'll never have it.
Yes. But yeah, we should have a couple of questions coming up, but we usually have the privilege of the first ones, Dala and I, because we are here anyways. So I will, luckily, like in December, I was talking to a friend of mine who actually worked at the Ministry of Health, receiving these litigations. And what she told me is that nobody wants to work there, because all the public servants are horrified of receiving these piles of suits, and they're afraid to be individually sued by lawyers, because they they can be sued if, I don't know, they receive I don't know the terms in English, but then they have this process there, and then the person died while it was in their table, in their desk. And then they are accused of prevarication, or like, so nobody wants to go there. Yeah. And what happens is that usually those who are public servants, they try to avoid, and then sometimes they have to hire extra people to work in that session. So generates a lot of problems. So I was wondering if
snowball.
It's a snowball, yes. If you also look at it from this public servant perspective, like in this idea of who responds for the state. So you were suing the state for health. Who is the state? You know, like, who responds for the state in that case? And if some individuals can get legally complicated, or like, who is the state?
It's interesting because it's against the lawsuit is against, let's say, the city of São Paulo or the state of São Paulo or the federal government, right? However, there are people behind them. These are legal entities, right? They're not people. So what happened when things were well at the beginning, and you were these, we have the compliance towards judicial decisions in Brazil is really good. So it's rare that the public administration wouldn't comply with a decision from a judge, right? However, so for example, in Rio, when the money was gone, there was zero reais in the budget, in the account of the healthcare secretary. And one thing that judges have, and this all judges, first agreed, every judge has access to something called a system called Bacenjude, which is a system directly linked to the banks. So they can access the accounts of anyone of us, or the government, right? So they can access those accounts. So one thing that was happening was, and this was, I think, on the first, when they first encountered situations that the public authority was not complying with the decisions, and they were not complying because they didn't have any money to buy the drug. They would say, so first they would say, well, but I see here that the budget of marketing has money, or the budget of transportation. And then they would say, well, marketing is actually superfluous, so we can take money from marketing and pay that drug. So in fact, what you're having is a judge from the first degree or the appellate court, whatever, meddling into the administration of the public budgeting, which is done by law. So the law is who defines, right? It's what defines what goes where, right? So there is a rationale behind how this money is distributed. And then you have a judge in the concrete case, right? Getting money from one place to the other. And he says, well, but this is the moral decision. And it might be, we might even agree, but there's a process for those things, right? Then in the second stage, there were the arrests, and that happened a lot. So judges would say, there's an authority that is not complying with a legal decision. This is a crime. Not complying with a legal decision is a crime. So they would have the mayor arrested, or the secretary of health arrested, or people so these are the cases where you would have people that would get their salary taken, or they would get, court orders to go to the. So it's crazy. Now you're actually putting these people in the responsible for fulfilling access to these drugs, and yeah. So, and then you also see, kind of from the judge's perspective, they were saying, well, we're kind of desperate because that person has a decision that is granting the right to access that treatment or that drug, and we don't have a way of making. And then the judge also feels personally offended. Some of them would come across like, how would they not comply with my decision? So there's kind of different levels of desperation with power, with also this level of distrust with the public sector. And of course they're not complying, they are corrupt, or they don't care about the people. So there's kind of all of these different levels of decision making that are in there. But I did interview the executive. And some of them would tell me these stories, but my focus was on the decision-making of the judge and the litigant.
Amazing, amazing. Darlan, do you have any questions or some from the chat? Because I already have my second one ready.
No, yes, I do have one question. So Fernanda, first, thank you very much for the talk. It was really inspiring. I'm amazed by the complexity of it, because as you mentioned, when we see the outcome, we only see the outcome, but we don't actually know what's behind, and we honestly just assume that it's the law and what the law says, but there's emotions and there's involvement and there's lack of communication and opinions and everything behind it. It's obviously it's humanity behind it.
Yeah, exactly.
So I was actually curious to try to understand if suing the government is the only route that someone could go down to, to actually get access to the medication, because you mentioned that it would be the fastest way to get there. But I was just, curious to see if, because it seems to be so frequent, so often that it is happening. So if not, why haven't we, as government or institution, society, put together ways in which these people could get an easier access to this medication? Of course, they cost a lot, but someone suing the government, and Brazilian population is not the most wealthy one.
Yeah, of course.
You have to hire a lawyer, and there's cost with it and everything. So how do these mechanisms also play out in terms of creating a barrier for people to actually get access to this medication beyond the law itself?
Yeah, I think your question has two parts. I'll start with the last one, just talking a little bit about what you said, the cost involved in litigation. Aside from litigation being almost free in those cases, right? So you do have another cost, which is your time. There's a social cost, or even knowing that you can litigate, right? Knowing that you have the right to healthcare, you have access to courts, all of that. We are presuming that, but there's a significant part of the society who is not aware of their rights, right? So when I spoke to a public defender in Santa Catarina, if I'm not mistaken, she said something that was, look, we are here representing a level of society, right? A section of our society, which is poor. But it's not the poorest. The poorest don't even come here. They don't even know what the public defender's office is, right? So, and this is something that is frequently brought up in investigations about healthcare litigation, not only in Brazil, particularly Professor Otávio Motas Ferraz, who's here in the UK. He investigates this topic lengthily, and one of the things he always says, and his empirical research has found that, is that healthcare litigation actually is only good for people that have money, for a medium and high class sector of society, because those people first have education, they know that they have that right, they are not afraid of the judiciary, they have access to lawyers, right? So it's actually something that only benefits. At the end of the day, it increases the inequalities, because you're removing money from the system for the most, the system that is going to serve the most poor, right? The poorest. You're removing a significant part of that budget to serve decisions that actually are being used by a sector of society that is more privileged, right? So this is a problem in itself. The first part of your question was, what can people do, right? And this is another problem of how of the roads of access we have to the government. There are almost none. To be honest, I myself wouldn't know where to go. So you have some small or some punctual initiatives. Some were good, some went well, some didn't go so well, but of initiatives of local governments, of having a center that was part of SUS, or that was from the government, or that is an initiative, let's say, between the prosecutor's office and the government, for people to go and to ask questions, right? Someone behind the counter that I can ask, look, I have this medical prescription from a doctor from SUS. He's telling me to get this drug. This drug isn't available in the pharmacy, or they tell me that this drug is not included in SUS. What can I do? You don't have these places, right? So we don't have, and so there is kind of an investment into non-litigation ways. In the UK, for example, mimicking something that the Nordic countries do a lot, they're investing a lot in ombudsmans. So ombudsmans are offices of the government. Companies have ombudsmans as well, who are going to listen to people. Most people wouldn't even go to litigation if they had at least someone who would hear them. But there is no avenue. The doors are closed. The only doors that are open in Brazil are the doors of the judiciary. If you have a problem as a citizen, to be honest, the only way that I know where to go is the judiciary. So it is a matter of investment in transparency and access of the public to the policymaker, or to the public authority in general, right?
Yeah, I was also just thinking that in case we actually created mechanisms that would avoid people having to go to the court, they, as you mentioned, they might even like take longer than going to the court itself, because of the way the Brazilian system works.
It's not fun going to court. No one goes to court because they don't have anything else, anything better to do, right? I mean,
yeah. Exactly, and it sounds also like a way of overwhelming the system with something that should have been mechanized already to have a proper solution for it, which is not going to court. Like, you shouldn't need to sue the government to actually get a drug. And in these cases in which you're actually suing the government for it, if you're always getting the drug, then what's actually the point of suing it?
Yeah.
We have a couple of questions. Andres, do you want to say something? Sorry.
Well, just to continue the discussion, because we should move to the questions, but on this issue of there is no other place, because health councils are so old, and the first ones, like when you think about all these participatory mechanisms in city, one of the first ones were health councils, which were obviously more focused on budget. Like, how do you spend budget on health, like for the locality and so on. But I was wondering if a little bit of that can be, if you see that as a possible place, or if that has been used or misused, underused.
Yeah, I think initiatives such as that are being underused for sure. Cases where, I would hear prosecutors say, well, we used to have an amazing initiative of a council, a place where people could go and they could speak to someone, but those have been shut or been underfunded, or, you would have one person there who was working extra hours. They didn't, even that, there was someone, I think it was a litigant, I remember where, I don't know if it's Campinas, somewhere in São Paulo. And the person told me, no, I went there. I went to that little place. And then the person told me, go to court. It's going to be, go to court, minha filha, It's going to be quicker. The person from the administration said, no, you should go to the public defender. They are very quick there. I mean, the incentives are there, right? So unless you build something, and it takes time, because it's a culture, right, of people learning that they have a place to go, getting examples of people that were well served in those places, right? So, but you need to create a place that is friendly. You have initiatives. So the state of São Paulo, the prosecutor's office in particular, is an institution that is able to create these bridges, right? So they do create the bridge between the judiciary and the government, and they are able to act with the government without suing the government, without litigation. And there are initiatives to create those kind of things. I don't know if they're already working. From what we see so far, we don't have anything that's been like, but it's interesting because so many patchy things have been put forth to, so let's say this Nacijus, which is an initiative that is a technical body to serve the judge. So what happens is now that these cases go in, they would be analyzed by this group that is a technical group within the court that would say if it makes sense or not, the claim. But it's money and efforts being invested into making the decisions better. And I think the focus there is wrong. I think it's important. Judges are not meant to know medicine. But I think the focus is wrong there. Why isn't there a focus to creating solutions in the executive, right? In the SUS? Where are those investments? And I see for so many years people discussing how do we make the decisions of the judges more technical, or how do we? That's not the focus. The focus is we shouldn't have to go to court.
Absolutely.
Yeah.
The question.
Yeah, we have a couple of questions. So the first one is from Eric. So he's asking, he's saying first, thank you for your presentation, and have you already published your findings? I would be interested in reading them.
Eric, that's the worst question because no, I'm kidding. No, the answer to that is I am reviewing now my PhD, and I should be submitting in the next couple of months. But for those who've done a PhD, you know that the last question you should ask a PhD is, are you finishing? Where are you going to be finished?
Oh,
Which is kind of, yeah, so kind of this is the follow-up question. But I hope that I'll have it published very soon.
Laughs nervously. Here's the second question from Eric. So this one's regarding moral damage. Is this included in court cases against the state?
Yeah, so it's interesting. These cases are not. They usually don't involve moral damages. So you don't see a discussion of people asking to be compensated for delays or. And another interesting part is that judges tend not to be very happy to grant damages against. So they're happy to grant the drugs, but not damages. So not pay people money because they weren't served. So we do have cases of damages. So cases of people that sue doctors or hospitals because of problems they had in their treatment. We do have cases like that, but these are not the excess healthcare excess cases, right? These are a different nature of cases, which happens as well, but is not the overwhelming number such as the excess cases. In the UK, the big problem is damages cases, and the US.
I think, Andres, would you have any other questions?
We still have another 5 minutes, so I do want to ask you, Fernanda. So, well, you started a very interesting discussion. I mean, all of the discussion was extremely interesting, but a point that caught a lot of my attention was this idea of the individual versus the social. So we all have a right to health, but the state also has the duty of, as the colleague put, like Eric, in another context of like what is moral and beyond what is legal and how do we spend money, and then I was thinking about how do we accept that something is individually very important but is socially not efficient. Is not. It's I don't want to use it's not about worth or value, but is about a duty to the commons, right? To the community.
Yeah.
And this is definitely a very difficult calculation. If somebody asks for a medicine that prolongs the life for another year, but costs like millions, but then that budget could be spent in another way.
Yeah.
And taking that decision, is there a procedure that you take? Because I know that in the UK, some things, they just have a cutting point.
Yeah.
Your chances of success are X%. They say it's not going to invest. There are some procedures. It's not like an individual decision.
No, it's not. Yeah, and it's impossible. And public policy decisions cannot be individual, because again, you have a limited budget to serve that purpose, right? It is a duty of the state, but it's a duty of the state within the limitations of the budget. And this is a problem. And you have an evolving medicine that is, 10 times faster than the increase than the investments in budget. So you have every day, pharmaceutical companies doing research in new drugs, and these researches are expensive. So the drugs are expensive, and they're investing, millions into trying to find cure or trying to find aid for the illness, let's say a rare disease illness that attacks a very limited amount of patients. So if you think about, for the government, for the policymakers, a very tough decision, because at the end of the day, you're saying, well, we have a limited budget, we don't have money for this drug at this cost. And for this limited number of people, so they do have to make a decision, and there is a procedure. It is quite a defined bureaucratic process that we have in Brazil with Conitec, the same that happens in the UK. Conitec was actually inspired in the NICE, which is the system in the UK, right? And there is a process. There is actually sitting in Conitec are not only people from the executive, from the Ministry of Healthcare, but also people from associations, from the pharmaceutical companies. So you have kind of a variety of people that analyze these, that go through the incorporation process, right? And who suggest for the Ministry of Healthcare to incorporate or not. So there is participation of several different levels, areas of society. So that it is a process. However, judges don't know about that, right? It is complex, and you shouldn't expect them to know, because they're not going to know everything about everything, right? So the point is that those decisions shouldn't be taken in the individual stance. Because they are decisions of public policy. They are not individual rights. They are socioeconomic rights. They're rights of our community. And I'm not saying it's an easy decision. Again, I wouldn't want to be a judge in that position at all. Like I would probably grant it. I think it takes a lot of guts to say, I'm sorry, you're going to die, but it's part of the policy. And this is why these decisions in the side of the policymaker are not taken individually, because you would need to take it from afar, right? If you look the person in the eye, it's impossible to say no. So everyone wants the cutting edge medicine for them, right? Everyone wants that. And if we had infinite budget, we want everyone to have access to that. It's really difficult being pragmatic. And I think that one of the things that is very different from the UK to Brazil is, and the numbers of these claims, there are successful claims in the UK. So for example, PrEP, which is the drug, it is a drug that is taken to prevent HIV contamination. It was denied by NICE. NICE said the NHS is not going to include this in our system because it is too expensive and it's preventative, blah, blah, blah. The Association of HIV Patients sued the government, sued NICE, went to court, and the High Court decided not that NICE had to include, but they decided a couple of legal standards. So one of them was saying that the NHS is actually preventive as well as curative. And they said, well, based on those legal definitions, now I'll give back to NICE, and NICE is going to decide, do their part, which is analyzing the cost efficiency. And then based on that, NICE said, well, actually, with those legal definitions, we are going to include. And today it is included. But it's done collectively. It's not done individually. And one of the things, this deference that the courts in the UK, the judges in the UK have towards the executive is part, of a system of more trust in general towards institutions in the UK, more respect between institutions, but mostly is the deference that they have towards the NHS. The NHS is, those indexes of trust, is the most respected institution in the UK is the NHS. So there's also kind of, there are legal points as well, which is, the judiciary in the UK has not, doesn't have a tradition of being activist. There is parliamentary sovereignty in the UK, which brings kind of the power of the judiciary a bit lower. But on top of that, there is this thing that is they are very proud of their system. There was there was just a curiosity. There was very interesting and qualitative research done about litigation in the UK, and it was involved healthcare litigation in the UK, and it was embarking all types of litigation. And one person said, I'm very ashamed, I'm very afraid that people would know that I sued the NHS because they're so amazing. So the relationship is very different.
Very different.
I'm really afraid of being caught.
Very amazing presentation. Then I think we are just over an hour. So do you have any announcements or?
No, I think we actually had one last question, but I'm not sure we had time for that.
Maybe you can put in the screen so Fernanda can potentially answer the question later individually too.
Yeah. So how decisions are taken in the light of the limited budget? Is there a priority list? Also, is there any promotion or advocacy of generic drugs? This is from Sophia. So yeah, maybe this is something that Fernanda could answer later on the comment.
Yeah, I'd be happy to do that.
Yeah.
But very good question, Sophia.
Yeah, a difficult question as well.
I do go on and builds up on what we were just discussing.
Yeah. No, so I would just like to say thank you again, Fernanda. It was really, really inspiring. It's such an amazing topic. We could just be here for hours and hours talking about it. And so thank you very much. Best of luck with writing your paper and submitting it and getting acceptance. And Andresa, back to you.
Yes, Fernanda, thank you so much for opening our seminar series. It was an amazing presentation, extremely timely, as we said in the beginning, very, very important findings that you presented to us, and we can only hope that we have your book very soon to read and learn from.
Thank you. Thank you guys for inviting me.
Thank you everyone for watching it, and we'll be back in a couple of weeks.
Bye everyone.